So as we wait for everyone's audio to connect, I'll just start off just so that way we have enough time for questions as we wrap up at the end, and also give everyone an opportunity also to complete their surveys as well. So I want to introduce Ayana Mortley from the New York City Elder Abuse Center at Weill Cornell Medicine, as well as Maggie Morgan, an E-MDT coordinator from Greater Rochester Lifespan team. We're going to host a webinar today on engaging the community, and I'm going to pass it off to Ayana and Maggie.
Hi, good to see everyone. Thank you for joining us for this session. I'm going to pass it off to Maggie and I will return about halfway through.
Hi, everyone. So I'm excited to be here today to talk about community engagement. Sorry, pause, thinking. Next slide. There we go. So I'm really excited to talk to you guys today. I've been a coordinator for 3 years now. And I know it can be kind of stressful to reach out, talk to people. So I'm excited to talk about that today. I run 7 teams, so I've had to do this numerous times. But techniques that I use to recruit and enhance my engagement with my teams. And I use multiple forms of communication when I reach out. The biggest thing is tailoring it to each type of profession. And when I say that, I'm more or less talking about like that salesman technique. I don't know if you guys have heard of Jordan Belfort. He's the Wolf of Wall Street, but his saying is like how to sell a pen. You don't kind of tell people how amazing the pen is. You ask people what are their needs, and then you tell them how the pen is going to meet that need. So same thing when I reach out to team members or other people in the community to try to engage them, to get them to become team members. The best way for me to describe this is to go through an example, because I can tell you to write letters and emails and phone calls, but what does that honestly mean? So I have an example. It's from when I started one of my teams, Genesee County. Next slide. Okay, so it's when I started my team, and so again, this is the best way for me to describe it. So when I started the team, obviously it's brand new, they weren't meeting yet, and I was trying to figure out how do I get these core members to the table. And the first way I started was an email to one of my colleagues. We have a lot of programs here at Lifespan, and only one program was in Genesee County. So I emailed her asking like, hey, do you have any contacts in this community that I can utilize? And she's actually at Office for the Aging. So she actually connected me with the director, and we emailed back and forth, and we kind of discussed a meeting would be great. We can explain what the team is, things like that. They're also really close, Office for the Aging, with APS. So we met as a big group, and at that group, I used that salesman technique. So I asked them, like, what do you know about the E-MDT? This is what it is. What are your needs? And how can the E-MDT fill those needs? Another big thing we talked about was next steps. Like, how can we go forward? Because APS and OFA were already at the table, but how can we get the district attorney's office and the sheriff's office to the table? So at that meeting, we decided that support letters from the director of Office for the Aging and the commissioner would really help in supporting them coming to the team and getting them excited. So they created one letter, they both signed it, and then I created a letter explaining what the E-MDT is. I put as many facts in there as I could. We sent out the letters in an email, and I received a response from the DA's office. And the DA's office asked for a presentation. So I was more than willing to go out to give a presentation to explain what the team is. I actually brought Lindsay along with me, but because it was a presentation, it's really hard to use that salesman technique. But I did try to give them everything I could about what the E-MDT is, all of the great ways. At that meeting, I was told that elder abuse doesn't exist in their county. I responded probably not the best way by telling them only 1 in 23 cases are ever reported to authorities. So then their next response to me was they just don't have time. But I left that meeting still feeling successful because they did agree to consult, and they gave me a list of contacts for law enforcement in that county. So I tried to see that as a win. Literally across the street from the district attorney's office was the victim advocacy program. So I literally walked with Lindsay across the street and we knocked on the door. My hope was just to drop off some flyers, but it ended up becoming a meeting where I got to do the same thing. I got to ask them more about their agency. I got to ask them, like, what are your problems and concerns that you're seeing in Genesee County? We talked it out and they loved the team. They loved that concept. And I asked them again, do you have any contacts for any law enforcement in this community that goes above and beyond? And they did. So they gave me his contact information, and I'm actually going to call him by his nickname, which is Johnny Law. So I called Johnny Law, told him about the team. He's like, this is great. I emphasized the forensic accountant on that phone call. So he asked me to write him an email to send to his chief of police. I did. Within that day, I already got a response, was told that this is, that they're totally going to do it, that they love it. I asked Johnny Law, though, are you all right if I use your name saying that you agreed to participate and you're a participant? He's like, of course. So I emailed the sheriff, because at that point, the letters to law enforcement, to the sheriff's office, I emailed multiple times, I've called, I got nothing. The moment I said that Johnny Law was going to be participating, I got a phone call back from the sheriff, and his actual response was, oh, if Johnny Law is available to do it, then the sheriff's office is available to do it. We're more than willing to send a representative. So at that point, the team started meeting, but I didn't have the DA at the table. And that was actually, that's a big player to not have at the table. And it's something that the team consistently throughout that next year discussed was something that they really wanted. So I used the ability to consult with them as much as I could. And I emailed them every now and then, like, hey, how are things going? Do you have more staff? Things like that. I kept it really soft. About a year later, they asked for another presentation. Of course, I'm more than willing to go out, but I figured I'll use a little bit of a different tactic this time. And when I went out, I brought law enforcement with me. It was one of the law enforcement at the table that everyone turned to get their opinion. It's everyone who's very well respected in the community. So I brought him with me, and we presented again to the DAs. This time they couldn't tell me that there wasn't elder abuse in the community because they had like 8 cases from the team. But again, I was told that they don't have enough time. But I saw this meeting as positive because I could sit down and ask them more questions this time. It wasn't really a presentation, but it was more of a discussion, and I could hear what their needs are and what was going on with them. So throughout that next year, I was able to send more emails and to be more empathetic of their concerns and their problems. But what ended up also happening too is I changed up how my emails were sent also, because we do feedback surveys at the end of every meeting, and almost every meeting, people identified that the person missing from the table was the district attorneys, and I let them know that they are wanted. Another thing that happened 6 months after that second presentation is we got this massive case, and I explained to them, like, look, this is out of the realm of anyone's normal of being able to address this. It's has numerous victims. It's a really heavy case. And I got them to the table, and it's still actually a case we're talking about today. So I got them to the table. I like did everything I could to I don't want to say suck up, but to do everything to make sure that I made it easier on them, that we made sure the timings were around them, to make it most convenient to get them to realize how great the service is. 6 months after having them actually come to the table, the district attorney's office, the DA actually emailed the whole entire team and said that he's going to assign an ADA to the team to only do elder abuse. And this is big because this DA's office only does local, like they do location based, they don't do crime based. So So this was a big deal to finally get someone and to get someone that's only going to do elder abuse. So I hope that made sense. I hope explaining like the different levels of how we reached out, how we asked for names, how we came up with support letters, really kind of explains the techniques of engaging and getting people to the table. But I will say I've had my fair share of mistakes and lessons learned. And it's when I didn't use that salesman technique. So for another county I ran for recruitment, I was contacting the state police. They hadn't come to the table at all. It was a team that hadn't even met a year. So they had a case. I was calling just to reach out to the case. I sent them a couple emails. And then from my discussion from the case on a phone call, I was like, hey, it'd be great if you could, be members and come more frequently. And I didn't use that salesman technique. Like, how is this going to benefit you? Since then, I've struggled to get them to come to the table. I have to plan other meetings around them to even get to talk to them. So again, I just really want to stress that like salesman technique about how can the E-MDT be beneficial for you and not how we can benefit with you on the team. So, that's how I've gotten people to the table. But once you get people to the table, I feel like there has to be that continued encouragement. And I think that's really important. And one way I do that is feedback surveys after every meeting. And the one that does a lot of community engagement is our yearly feedback. So I create a yearly feedback survey and I base that off of the Indicators of a Healthy MDT by Jody Lacey. So there's 16 key points that she has. I used 12 of them because some of those techniques are things that the coordinator needs to do. But some of the questions I like to ask the team, are you familiar with other people at the table? Because if you don't know what other jobs people are doing or you don't understand their role, there's no way you can say who or who isn't at the table. So what my team members like to do is they like to do agency presentations from everyone at the table. And they've also asked for continual. So even if APS has done a presentation, they want to hear from APS again a couple of years later because things change. What they see change. They want to know everything that's updated because we want to be involved and support everyone on the team. I feel like that also ties in to getting people to the table because then I can ask them, hey, so we know what everyone's now doing. Who do we need to come to the table? So even talking about using my Genesee example, they have now met for 3 years. We had a feedback survey, this big yearly one, a couple of months ago, and they identified 2 agencies that are missing. So it's always good to constantly ask because we don't know until there could be new agencies. So you don't know who you're missing. And then another way I like to engage the community is also by asking them, is there any presentations or is there any information that'd be helpful for you to learn more about elder abuse? Because when I go out, I can connect to people that are potential referral sources, or they become potential team members because we can learn about not organizations, but programs that they have. So I feel like that continued team engagement leads to continued community engagement. It's like the cyclical cycle. And I really want to emphasize once you get people to the table and they come to the presentation, my last question I asked from the survey, and I think this all ties together, is, are people feeling comfortable at the meeting? Can they openly talk? Are they able to have are they able to vent their frustrations? Because I really feel like preventing that burnout and being able to discuss what your actual concerns are makes it a place where people can come bring cases and express their frustration, and we can address that. We can address victims' frustrations. So I think that leads to that continued cycle of community engagement, and then team engagement leads to success. Yeah. I think that's it.
Thank you, Maggie. Thank you for sharing that example. That actually really concisely illustrated where there are challenges and what the process realistically looks like of recruiting partners to E-MDTs. And you touched on a lot of what I will be touching on as well. So hi, everyone, again. My name is Ayana Mortley. I am the training coordinator for the New York City Elder Abuse Center. So in my role, I'm responsible for education and training opportunities related to all of NYSEAC's programs. And so that includes the E-MDT, our E-MDTs, but also our Elder Abuse Helpline for Concerned Person, and now increasingly with the National Center. So that's why I'm excited for this opportunity to meet and talk, have a dialogue with all of you. I'll spend what I hope will be a brief time, but feel free to cut me off if I go on too long, talking about outreach targets for E-MDTs, whether these are budding E-MDTs or sustained E-MDTs that are being sustained. So some of what I'll be talking about is relevant to building partnerships for people who will have a seat at the table at E-MDTs. But because my role is more about disseminating education about elder abuse and conducting outreach to a variety of professionals, my scope will be a little bit more broad as I discuss my lessons that I've learned in this work. Is everyone familiar with the Elder Justice Roadmap? I'm looking for nodding heads. Half of you have cameras off. Great, thanks, Lindsay. This document is designed to inform our work and our priorities in elder justice. So that includes our policy priorities and ranges down to our direct services priorities. The subject matter experts who created the Elder Justice Expert engaged in dialogue on building on responses from 750 stakeholders who were all trying to complete the statement to understand, prevent, identify, and respond to elder abuse, neglect, financial, and exploitation. We need X. So these subject matter experts concluded that education priorities should be to provide education and training about elder abuse and elder justice within professions, within agencies, within disciplines, as well as within multidisciplinary settings that bring together a variety of professionals across disciplines. So this means that we do have guidelines for whom outreach should be conducted within elder justice, and these guidelines can and should inform our work. So who are the outreach targets for elder abuse MDTs? I mean, really anyone who can identify or report or intervene in elder abuse situations. And who is that? Everyone, essentially. If we're to follow the recommendations of the Elder Justice Roadmap, outreach targets should include so this is not an exhaustive list, should include aging services, care managers, forensic experts, all professionals in elder abuse, of course, justice and legal system professionals, mental health service providers, victim service providers. It may be useful to conceptualize these outreach targets as part of an ecosystem. So refer to my crudely drawn chart. Consider who are the closest supports of older adults who may be the very first to identify potential abuse. So we know these supports could be friends, family members, neighbors, Tai Chi groups frequented by older adults, activity communities, faith communities, caregivers. And so keep in mind that these community supports are often impacted by the abuse. And so, as we know, need support through programs like the Elder Abuse Helpline for Concerned Persons, so that the elder abuse situation hopefully doesn't rise to the level of needing an E-MDT. We should also consider the service providers to older adults. So those who are likely to observe the older adult interacting with their trusted contact, who, as we all know, unfortunately is most often the person causing harm to the older adult. So this includes home delivered meals providers, financial industry professionals, medical and healthcare professionals, all of whom sustained their services and became primary providers for older adults through the pandemic, as many of the other typical support systems transitioned to remote work and reported challenges, as we know, in being able to identify elder abuse. And really any professionals who come into contact with older adults. So we can even think broadly and include postal workers who would notice if, we know that we've been delivering mail to this woman for a very long time and we see that the mail has been piling up. That is a concern. Do they know what resources exist in elder justice? Do they know where to report elder abuse? These are targets to consider. Front desk staff who, in the context of a medical office, they often are seeing what's happening in that waiting room, the interaction between the older adult and the trusted contact or a person who may be causing harm. And the trusted contact may then appear very charming when they're actually in the doctor's office, for example. So those front desk staff, maintenance staff, kitchen staff, food servers, these are all professionals who should be outreach targets for us. And then finally, we want to think about who has the power to bring elder justice into the local and national lexicon and zeitgeist. We've heard a plethora of disturbing anti-ageist statements early in the pandemic, with some politicians advocating for older adults to sacrifice themselves to the virus so that economies can reopen and thrive. So in order for the values of the public to shift, and for anti-ageism to be valued, we should consider conducting outreach and providing education to those who make our policy, who lobby their colleagues and rally the public around important issues like this. So it can be considered, so our outreach targets can be considered an ecosystem of sorts. That's really a feedback loop. I want to take a minute and talk about outreach to underserved populations. I mean, as we all know, anti-racism and racial equity work has recently increased in priority, not just in elder justice, but across many disciplines, and has been a topic of importance for us specifically. A growing amount of the population, as we know, are members of underserved populations, but we know that there's very little research, not just in elder abuse, but especially on elder abuse as it impacts members of underserved populations. Two studies of note, I got two citations on this slide. Two studies of note come to mind that inform our responsibility for doing outreach to underserved populations. A 2014 study that indicates that African-American older adults are more likely to be financially exploited than their Caucasian American counterparts. And a 2012 study of Latinx immigrants that found that 40% of the sample included in the study reported having experienced elder abuse in the previous year, which we know is a rate much higher than national prevalence studies. So these studies, of course, indicate that it's imperative for professionals to give attention to these populations and to be mindful about whether our services, our resources reach underserved populations. And quite often we don't do that because a lot of the research that we're working with is research about white people, and many institutions just don't take the steps to conduct the outreach and increase access to these underserved populations. We already know that compounding those barriers are systemic inequity. And so again, this is an important topic for us. This is an important target for us to think about. In the New York City region, I have been working to conduct outreach to organizations that represent members of underserved populations. So just in our region, we have organizations like JASI, the Japanese American Social Services, Inc., the Polish and Slavic Center and Polish and Slavic Federal Credit Union, the Taiwan Center, the United Hindu Cultural Senior Center. So relationships with these kind of organizations not only increase identification and reporting of elder abuse in these populations, which, as we know, is extremely underreported, as is in elder abuse in general, but also help E-MDTs when we are working with members of underserved populations who are experiencing elder abuse, and we're working to provide person-centered, trauma-informed interventions and create action plans to that degree for these older adults. There's an example that comes to mind of a New York City E-MDT case in which a video surfaced that appeared to be of the older adult being experiencing physical abuse at the hands of their family members, but with partnership from a professional who had an understanding of the older adults culture, it was explained to the E-MDT that the video was actually representing a ritual that's very common for the cultural and the religious group in which the older adult was part of. So that informed the way that the E-MDT decided to proceed with putting together the action plan for that case. So these partnerships are extremely important to us. When we do conduct outreach, even to professionals in these spaces, we are thoughtful about the language that we use. And so, we know that the language that we as professionals may use to describe abuse and abusive actions just may be different for different generations and different cultural groups. And so even the word abuse may not directly translate into the primary language of many other people whose primary language isn't necessarily English. So we are very conscious about the language that we use, even in outreach to members of underserved populations and the organizations that create spaces for them to gather and be heard and be served. Yeah. So, so now that I've provided some examples of outreach targets and priorities for E-MDTs, I'm just going to take a brief moment to vent my frustrations regarding my outreach efforts. I'm just kidding. But in truth, conducting outreach and building partnerships, as Maggie already illustrated, is not necessarily easy. While aging service providers, including senior centers and elder abuse prevention and intervention professionals, are likely to be mandated to receive annual training in elder abuse identification and resources, many, many other professionals are not mandated to receive this education. And unfortunately, there's some professionals who don't even believe this education is relevant to them. So this presents barriers in conducting outreach around elder justice and elder abuse, and sustaining attention and urgency around elder justice and elder abuse. I have found success in conducting outreach to healthcare professionals who often work with older adults, identify suspected abuse, may have frustrations in navigating the elder abuse intervention landscape. So hospital social workers, discharge planners, home care agencies, geriatric care managers, they often can encounter older adult frequent flyers who have repeated admissions, referrals, or disruption of services. And these professionals may desire to be connected to E-MDTs for streamlining of interventions and for further education about what elder abuse interventions look like and what systems are often involved in the intervention process. Caregiver support programs often identify cases of suspected abusive individuals who have cognitive decline or dementia, forms of dementia. And these professionals often want support in connecting to an E-MDT and have an interest in determining whether the needs of both the caregiver and the older adult can be met through an elder abuse intervention. Community boards or local volunteer-based community advocacy groups who are not always comprised of professionals, often comprised of community members, still have really deep connections within communities and are very good at gathering professionals and community members alike who care about community issues, who want to share their resources, as well as learn about other resources that can address the community's needs. Professional trade associations. So these associations, I've been blown away at the success that I've had with professional trade associations. They bring together professionals who have the same credential, but represent a variety of professions and agencies. These trade associations also are responsible for providing regular education opportunities to their members. So they already come with their own platforms, and they are they're a great partner to bridge gaps between E-MDTs and that just variety of disciplines that are out there. Just in the past couple of months, we've had a lot of success providing education and building partnerships with the New York State Federal Credit Union Association, the Association of Certified Fraud Examiners, the Association of Certified Anti-Money Laundering Agents. So these trade associations have been a very good partnerships for us to build. Alternatively, where we have found challenges, I have found challenges, has been with faith communities in the New York City region. Faith communities as we know, are a population that are constantly touted as being an extremely important partner in elder justice work, especially if we are talking about trauma-informed interventions, partnerships that are conscious of historical trauma, immigration trauma, race-based trauma, who are partners that do not represent the systemic racism that is in every discipline that we work with, really. But sometimes there is a lack of understanding of the positive role that faith leaders and communities can play in the lives of older adults who identify themselves as members of faith communities, but also who don't identify themselves as members of the faith communities, but have identified their own spiritual needs. I know that someone in this room, I'm looking at you, Lisa, has been a partner in creating education for faith communities, in conducting outreach and bridging gaps between faith community and elder justice community. So Lisa, I'm going to put you on the spot. Do you want to talk about your work in this domain?
Well, let me just say a few things in terms of piggybacking on your professional trade association. It's important that you can know your community. And so are there some religious communities that have a member organization like a downtown ministers coalition, or talk with the domestic violence folks and see if they're already partnering with some faith communities. But also, if you're looking at those underserved populations, are there congregations that are with the Latinx community? Is there a big Catholic church that does a Spanish mass? Are there already parallels and partnerships that you can tap into around that kind of thing? But I'd also say that faith communities are going to want education on this, and to think about it in terms of Maggie's salesmanship kind of thing. You know, what can you give? You know, this is already happening in your community, and we can give you a resource that you can offer to your congregation and your faith community that can address that. And go ahead and tap into the faith communities that might be sitting around your table that people aren't telling you about. In other words, some of the service providers in their private lives are connected to faith communities and aren't talking about it at work. So tell people to come out about their faith and where they are with that, and see if they can help make some connections and know of places that would be welcoming and ones that would not be. But yeah, Ayana, thank you for giving me a chance to talk about something that's near and dear to my heart, because I do think that older adults having the faith community around the table is very important. And the faith community looks different in so many different communities. And so let's keep that in mind as well.
Thank you, Lisa. I was just taking notes on what you said, and I think we should talk offline because I need your help. Thank you. So yeah, I mean, I can talk ad nauseum about this and the different populations that I've had successes and challenges with in the New York City region. I'm happy to talk more about it offline if people are interested. I will not bore you with my frustrations and challenges. So I'll just wrap up and give an overview of some lessons that I've learned about getting a foot in the door. We've already established that building partnerships, conducting outreach, establishing buy-in is not the most simple. So these are just a few things that I've learned about how to increase success in this domain, how to get a foot in the door. So cold calling is rarely successful, at least in my experience, especially if the outreach if it's cold email, like especially if the outreach is very wordy. I've been working to create like several visually appealing flyers that I found have received more response to and interest, like this one on this slide. The flyers are, designed to be eye-catching, succinct, with clear contact information about what exactly is being offered. Let's see. So pitching education and partnerships can also, in my experience, fall flat if you're not addressing the language and the perspective of the outreach recipient. So financial institutions and medical professionals, for example, they want to know how these partnerships benefit them without creating more work for them. So to bridge gaps, I have recruited partners from the same discipline to conduct the outreach, to help me conduct the outreach, and that has been a useful strategy. So I've had geriatric psychiatrists connect with other psychiatry professionals, and they know where the barriers are, what the challenges are, and how to reassure them that we will address that for them. And the same with having fraud investigator connect with financial professionals. They can better speak to the concerns and needs that the outreach recipients may have more so than I can as a former case manager. To Maggie's point that she's making earlier about establishing regular connection with partners to maintain investment, maintain interest, maintain that network, and keep this work on the radar for them. So yeah, connecting monthly, connecting quarterly, connecting annually, making sure that you're offering further education, reminding them that the resources that we offer in a gentle way, not an aggressive and hostile way. Recently, I've been encountering, so we have an RFP that's open in New York City region, and quite a number of organizations actually are interested in completing linkage agreements with us. So that I see as an opportunity for us to hold each other accountable and keeping this on the radar so that people don't just, forget that this should be a priority. Sometimes new outreach recipients and new partners hesitate to build partnerships with E-MDTs because they've had poor experience when previously reporting elder abuse situations and navigating the elder justice intervention landscape. So we show how strong our partnerships are and how effective our model is by sharing our partners, we can build trust. So sometimes I don't know if this is how common this is, but in our area, there can be frustration with referring to adult protective services because, many professionals don't fully understand the criteria of APS, and they'll say, look, we've done this before, it didn't work. Why should we care now? And so sometimes okay, well, guess what? This APS regional director is perfectly happy to have her contact information shared with you, and so that you can communicate when you face these barriers and these challenges. And so sharing those partnerships helps us build trust and leveraging our contacts and showing that, look, we have a tight network. What we're doing is working. Again, we talked about being conscious of language and framing. So when two other points. So when we ask professionals what they want from us, what they have indicated is that they want to know, A, how prevalent elder abuse is, AKA, why does this matter to us? B, what indicators of abuse to look at that's specific to their job role. So a bank teller will be invested in some different information than the fraud department of a financial institution, perhaps. They want to know what language they should use to engage their clients who are older adults, what resources they can share with their clients, because quite often I've heard that, we want to help and we tell the client that we want to report and we're afraid and they are in denial. The client lacks the education, the community lacks the education. So how do we help to educate and support our clients? What resources can we pass on to them so that when we do encounter abuse situations and we want to report and we want to collaborate with them in keeping them safe, we can have more collaboration and cooperation. So those resources, they want to know what elder abuse resources are the most viable and how they actually work, and what resources exist to streamline interventions and make their reporting process simple and easy. So we, of course, eagerly share with them the benefits of multidisciplinary collaboration. And that has been, rather than reiterating, all the resources that are out there, multidisciplinary collaboration has been a very appealing topic and premise for many professionals who are not that invested in elder justice. Lastly, outreach to rising professionals. I think that is a target where we have had a lot of success through educational institutions. Elder abuse education, as we know, is rarely a part of many curriculums. Even a geriatrics program curriculum rarely has elder abuse embedded in it. So, and professors are often eager to introduce a new topic into their curriculum. Then you have, we know there's students who are still, like I was back then, still trying to figure out where their passions lie. And so our work inspires young people, to rising professionals and students, to champion elder abuse wherever they go in their career. So we've recruited someone to help us in our work as they go through their careers. And so rising professional students, I'm not sure to what degree that is outside the immediate scope of the work of E-MDTs, but something to think about. So I know I want to leave enough time for questions. Thank you for listening to me rant. What I've shared with you has just come from my 2.5 years of experience conducting outreach and building partnerships in elder justice. So I am still learning, and I can absolutely learn from all of you. Sustaining E-MDTs through the events of the past year has really, at least what I have found, brought new energy around elder justice outreach and partnership buildings, given the ageism, systemic racism, social isolation we witnessed, acknowledged, and reckoned with in the past 1.5 years. So we're continuing to be intentional in our efforts, identifying new strategies and conducting this work. I'm happy to answer any questions. I know Maggie's happy to answer any questions. And I'd also be interested in hearing from all of you about your perspectives, your efforts, your challenges, how you overcame them, because this is a learning opportunity for me too. Thank you.
Thank you, Ayana and Maggie. Definitely, I thought it was definitely eye-opening. I always like to hear the perspectives from other teams and other coordinators, as well as, what your process is for outreaching to different community members. So I think that ecosystem is very important. So we're going to open up for questions from the participants. So if you guys have any questions or just want to share your experiences, it might be helpful. It might help someone in the room. And also the questions, again, Ayana and Maggie are more than happy to answer. And I also put in the chat, if you're more comfortable typing it in rather than speaking, that's fine. I'll just read it out and hopefully we'll be able to share with one another.
This isn't a question, it's more of a comment, but I just wanted to thank Ayana for mentioning, when you're talking about community engagement, the access points for people who may, be recognizing what's happening, because when I was in elder abuse prevention, we had several referrals from hairdressers. So don't forget your, any profession really, where people may have regular appointments and things like that. So I love that you brought that up.
Also yesterday, when we kind of had a conversation, some people did bring up some of the challenges with onboarding new team members. So I guess this might be a question for Maggie. When you're outreaching to the community, what are some thoughts on how do you welcome individuals to your team and work with the team dynamics?
Welcoming new team members. So of course I try to offer before they even come, hey, do you have any questions? I go into a little bit more detail of what the meeting's gonna look like. I even talk about how the first thing I'm gonna do is I'm gonna read off attendance and I'm gonna make you say hi when I say your name. So I don't want anything to trip them up when they come to the meeting. Sometimes my new members, I do say, hey, I'm sorry you're new today, but I would like to put you on the spot. So I also try to make it light. And also let them know that it is a fun, happy environment, even though we are talking about something intense. And then I always try to follow up afterwards too, to have a conversation. Like, do you have any questions? Do you know people's roles? And just to have a discussion with them. Because I think I can talk about like this complex, what is a team? Like, we'll literally sit around a table and we review a case. But then you go to the meeting and you're like, oh, I have this question, this question, this question. So I always try to follow up afterwards. I feel like that after conversation is more important than a beginning conversation. Because especially people have questions about like actual cases that were discussed, things like that. So that's how I introduce new members. Yeah.
Thanks for that. And I also think the debrief is very important as well. I see we have a question in the chat. Are sites using commemorative events like Older Americans Month or World Elder Abuse Awareness Day to better engage with possible community members? And I know Ayana has great experience with that, as she's usually connecting us with different workshops and conferences that are going on all over the country. So I'll leave that to Ayana.
I think you give me more credit than I deserve, Kylan, but thank you. So yeah, the good thing is that there are so many organizations, I mean, as you know, so many organizations that rally everyone around WEAD, around older adults month. And yeah, we help to, well, I will be transparent and honest. So in my role, I think we are just starting the work of us independently leveraging these commemorative holidays in our outreach to New York City professionals, but we do build upon the existing national and local organizations and efforts and events to pull people in. So which helps us establish buy-in and say, look, we're not the only ones trying to get you to believe this is true. Like, this is a movement. This is a major movement. There are lots of partners. This is societal change that we are working towards. And so we leverage the currently existing organizations and efforts in our outreach and pulling and connecting the two together.
Ayana, you mentioned earlier about professional groups and reaching out to them, and they already having a quota kind of built in that they need to have trainings for their individuals. Can you talk more about that process and how you got into reaching out to these organizations?
Yeah, so I mean, this kind of started with the efforts of cold outreach, cold calling, cold emailing, and also like challenges in trying to identify there's so many organizations. Trying to identify what organizations to prioritize and how to actually get contact information for organizations that are out there, like an email that someone will respond to. So the professional trade associations, they have websites, they talk about what they offer to their members, they have contact forums, they often do provide contact information for the president of the New York chapter, for the other members of the other members of the other administrators for the trade associations. So I was more likely to get a response, to get an email address of a human being who will respond. And again, because they are responsible for providing education, they have their own platforms, they're looking for new topics to provide, then they're already invested in bridging that gap there. If we're offering them to Maggie's point earlier about the Wolf of Wall Street, giving them what they need. So the pitch is that we're providing them with something that they need. You need a topic, this is important. You already have members, they will show up. We're helping each other build this community.
Did anyone else have any questions? Anyone have any comments or experiences they would like to share in regards to successes or challenges they faced with engaging in the community?
I also would be interested in hearing if any of the stuff that I have, like if people have had different experiences, because the outreach I'm doing is New York City specific, and I could be doing it all wrong, and that's why I'm failing. So I would love to hear other experiences, organizations and disciplines where you've had success, where you've had challenges. That's just from my own personal education.
I wanted to swing back to Laura Ivankovich's question about community events and that kind of thing. I think oftentimes with some of these community events, whether it's a walk a mile in her shoes, a domestic violence event, or various kinds of things, a lot of times it's the partners and the people who put it on who are there most. It's harder to get a broader swatch of the community, if you will. But inevitably, you'll get one or two people who didn't know about the organization, who just saw the topic and come in because it's personal for them, which gets you to folks that you never would have seen otherwise because they've not accessed any services. It doesn't necessarily, unless you take that connection and turn it around and see where they are in their professional life or other groups that they're connected to. It's getting the word out, but it's not necessarily building your E-MDT team, but it has the opportunity for that if with every engagement, you ask questions around their professional life and their professional and social organizations that they're a part of as well. And I would also say that you want to be doing that of the E-MDT members, that they should be willing to farm, if you will, their personal and social groups for other connections to that work group as well. And I appreciate Laura bringing that up, especially in light of just coming out of May and heading into WEAD, as Ayana mentioned. So.
Yeah, and as you were saying that, Lisa, I was kind of thinking about, as coordinators or during this conversation, we're talking a lot about reaching out and engaging, our community partners. But I think that on the flip side is kind of reciprocating and showing up to their events.
Exactly.
And giving that support, or even just, Social Work Appreciation Day, sending some type of acknowledgement for the work that they're doing outside of the E-MDT. And so, because if they're holding an event, they're trying to do the same thing and get engagement and buy-in. So by showing up and supporting on the other end, I think that can be really powerful.
It's what being a community is all about.
Mm-hmm.
And I always think that it's important to also think about community engagement in the way of bringing cases to your E-MDT. So the ability to outreach to someone to let them know that this is a topic that they're discussing. So when they see an elder come in and this person is in distress or need services, they know who to call and know that there's a program in existence for it. So thinking of it in the other way, that not just as this person as getting them to be a partner, but also getting them the opportunity to bring some cases to the team to get older adults more assistance that they need. So again, getting the word out also brings more cases to your team, as well as getting people to understand the power of the E-MDTs for themselves, being able to see an elder come in distress and then be able to receive assistance as the team continues to work with their case. Are there any other questions or comments? Well, thank you, everyone. We put in the chat the survey. So if you want to just take the last couple of minutes to complete the survey, that would help us be able to plan better for our webinars, as well as give us some additional ideas and thoughts and comments. So again, please take the last couple of minutes to fill out the survey. We have put the link in the chat. I also can share with everyone after the webinar, I can send out the article that Maggie mentioned, that's written by Jody Lashley, The Indicators of a Healthy Multidisciplinary Team. If that will be helpful to everyone, I'll also send that out. Thank you.
Thank you. Great to see everyone. Have a good rest of the day.